Hi, I'm Robert Kraig, Executive Director of Citizen Action of Wisconsin, and this is our second initial response to Governor Walker's rejection of billions of dollars in federal Medicaid money under Obamacare. Now, the big problem is that Governor Walker has, through smoke and mirrors, tried to create the impression he's actually expanding coverage, and somehow this is a good deal for Wisconsin, when in fact it's something where he is giving billions of dollars back that could have greatly aided health security and health freedom in this state, but trying to deny he's doing it through very complicated mechanisms that the media doesn't fully understand. What people need to understand is that when he talks about 224,000 additional people being covered, he has mostly people covered under Obamacare. So he is forcing people from Badger Care that are above the poverty level into the new federal health insurance exchanges, the competitive health marketplaces under Obamacare, then by sleight of hand claiming credit for that coverage. And in fact, he's forcing a lot of people into that coverage that it was not designed for, where the premiums and co-pays are too heavy and they will not be able to afford it. So in fact, it makes things much worse for those people. President Obama is increasing Badger Care, or at least he says he is. We do not have the full plan, but from the talking points we have from Governor Walker and his PowerPoint, he says he's expanding Badger Care for people under the poverty level. It needs to be understood that those people would have been covered anyway by the Medicaid expansion, so it's not new. But we're going to have to pay, as far as we understand, the state of Wisconsin 40% of the cost, where it was 100% federally paid for under the expansion. So certainly not a good deal for Wisconsin. We are very, very concerned, by the way, that Governor Walker's numbers are inaccurate. He's claiming about 88,000 fewer people covered by the Obamacare expansions of the exchange and of the exchange than we actually believe is the case. So there might be 88,000 people missing. A number of people being forced off Badger Care will not be able to afford the exchanges and will not be on them. So those are not covered people, as Governor Walker has suggested. He also claims that he is somehow doing something about dependency on government. And what Governor Walker seems to be saying is that if you're in the exchanges and there are subsidies to afford private health insurance, that's not dependence. But being on Badger Care is dependence, even though it is cheaper to insure people who are low income on Badger Care and Medicaid than it is on the exchanges. It'll cost the federal government more because of this decision. So when he says it's about the national debt, that's not true at all. When he says this is about concerns about whether the money will be there, that's not the case at all. First of all, the money is there, it's appropriated, it's just something he is saying in order to confuse the public. He's not leveling with the public on any of this. And then further, I think even worse as far as this bait and switch, if he was really concerned about the Obamacare money not being there, why is he forcing people onto the health insurance exchanges? It makes no sense. In other words, he'd be fine if they were all cut off by the federal government by the same logic, if you believed a word he was saying. So here's the bottom line. Governor Walker is trying to confuse the issue and have it both ways. He is trying to make it look like he's expanding health coverage, where mostly what he's doing is trying to claim credit for Obamacare while making it worse by not taking one of the key features, the Medicaid expansion. On top of that, he is trying to position himself nationally as a great opponent of Obamacare who is blocking it, who is against it in all its respects. So he is both trying to get credit for trying to undermine healthcare reform and claim to be expanding healthcare access and coverage. They're not both true. They can't both be true. I think people who are listening to this video know which one is true. And it would be nice if Governor Walker would at least state his case with real facts, real information, put out a full plan. There is still not a full plan. And I want to caution people in the media, yet again, to stop reporting that Governor Walker is expanding coverage to 224,000 people. He is not doing that, okay? We're going to have less coverage because of what he's doing. He's taking credit for Obamacare, which he vehemently opposes and has tried to undermine at every step. And he's making it worse by turning down one of its most important features, one that will, as we pointed out, not only cover 170,000 more people, it will also create over 10,000 jobs. It also saves the state money. A bad deal for Wisconsin. At least the governor should explain why he's doing this rather than misleading the public and confusing the issue by muddying the waters.